Hi, welcome back to my channel of Simplified Psychopathology. This is Ritvik Sharma, your host. My last video was on hypersomnia and sleep disruptive disorders. And this series is on sleep disorders. So this video is on narcolepsy. So let's talk about narcolepsy. At one time or another, you probably force yourself to stay awake, and might be while driving, or might be while when you're in a lecture or something. Talking about narcolepsy is an ability to regulate sleep-wake cycle when you don't have ability to regulate the sleep-wake cycle, and that is impaired. Okay, and normal boundaries between sleep and wake cycle is weak, leading to frequent lapses into sleep and elements of sleep wide awake. So that is what is narcolepsy is. You're not able to you're not able to maintain that sleep wake cycle. That is what when you're having narcolepsy. Okay, narcolepsy is usually treatable, but the condition is still cause severe disruption in your life, ability to work and social relationships as well. Okay, and then we will talk about symptoms of narcolepsy. There are four main symptoms of narcolepsy, but most people with this condition don't have all four. The four main symptoms are excessive daytime sleepiness. This symptoms happen to improve with narcolepsy. People with narcolepsy and experts on the condition often describe this as sleep attacks. अब excessive daytime sleepiness में क्या आएगा कि आप you will doze off sleep while talking, or you will doze off sleep while sitting in a chair or while driving, and you will be alert when you're taking a 15 minutes nap as compared to other people. Okay, in narcolepsy, even if you're not having a full day sleep as a compared to a normal person and taking 15 minutes of naps, you will feel alert for some times. And also, you will go to REM sleep very rapidly as compared to a normal person. What about, let's talk about sudden muscle weakness. This can have a mild affecting one side of your body or only light muscle weakness. So you can have cataplexy is like muscle weakness. You can have muscle weakness at around your whole body or also on one side of the body, and which can cause problems in your body. And sometimes you will feel anxiety about that because you can get that problem in a party or in a place where you don't like to have that thing, and you can fall down in cataplexy and you cannot get up. And sometimes it can happen that the whole body has muscle weakness, so that kind of problem can occur. Sleep related hallucination, that sleep related hallucination is another type of symptom. This happens right after falling asleep or right before waking up. Right before falling asleep, that is hallucination is known as hypnagogic hallucination, and in the awakening it will known as hypnopompic hallucination. So this hallucination can be when you're in the bed, you would be finding that there are some animals or you're falling down. That kind of hallucination can be coming up in this sleep related hallucination, and you can wake up in these hallucination, and you that would be waking up in anxiety or waking up in terror. And you can also have sleep paralysis. When you have this symptom, you will wake up sometimes fully but not always, but you find yourself unable to move. That is sleep paralysis. Okay, and in narcolepsy you will have sleep paralysis again and again. That is what are the symptoms of narcolepsy. Okay, then we have types of narcolepsy. There are two main types of narcolepsy, and whether or not you have catalepsy separates the two. Okay, then in narcolepsy 1, we have cataplexy, and about 20% of narcolepsy cases are type 1. And in narcolepsy type 2, this form doesn't involve cataplexy. The majority of narcolepsy cases, about 80%, are type 2. Under ordinary circumstances, your brain shuts down most muscle control in your body to keep you from acting your dream. People with cataplexy will have sudden muscle weakness, similar to how your body blocks movement during REM sleep. Okay, in the REM sleep, your body voluntary movements are blocked, and that is why it is known as cataplexy, which is coming up here. Muscle weakness आ रहा है. More about sleep paralysis में, your brain shuts down muscle control in your body to keep you from acting out in your dreams, but this should end when you wake up. लेकिन नार्कोलेप्सी में क्या, however, if you have sleep paralysis, your body doesn't regain muscle control as it should when you wake up. But you can still breathe, you can move your eyes, but you can't talk or move or the rest of body. ये हम लोग के साथ भी कभी कभार होता है जब हम सही से सो नहीं पाते हैं, और या फिर we have the problem in circadian rhythm. This can happen with us, but that doesn't mean we have narcolepsy. Okay. Let's talk about other symptoms. In addition to other four main symptoms, some other symptoms or behavior are common in narcolepsy. Some of the other common are easily noticeable behaviors include automatic movement. People with narcolepsy can often fall asleep, but may keep moving parts of their body like their hands. Amnesia और forgetfulness. अब भाई आप सही से सो नहीं पा रहे हो तो आपका amnesia forgetfulness होगा, क्योंकि आपका cognition सही से काम नहीं कर रहा है. Sudden outbursts around sleep attacks. आपके एकदम से आप उठ जाओगे. Person with narcolepsy may suddenly speak up and say something, usually words or phrases that are non-sensible or unrelated to what's happening around them. When someone with narcolepsy does this, it might startle them back to fully awake. बट मोस्ट पीपल हु इज ऑल्सो डोंट रिमेंबर डूइंग इट. बहुत से लोग नहीं समझ पाते क्योंकि ये अनसेंसिबल है. हाउ हु डज नार्कोलेप्सी अफेक्ट? Healthcare providers usually diagnose narcolepsy in people between the age of 5 and 50. However, it is most likely to appear in young adults in the late teens and early 20s. Men and people assigned male at birth, AMAB, have a higher risk of developing narcolepsy. How common is narcolepsy? Narcolepsy is uncommon. Available research shows that it affects 25 to 50 people out of 100,000 worldwide. However, this condition often takes years to diagnose, so the actual number of people with is difficult. क्यों हो रहा है बहुत ज्यादा एक्चुअल नंबर डिफिकल्ट हो रहा है? क्यों? यहाँ पे सारे सिम्टम है वो एक में नहीं मिलते, अलग अलग सिम्टम्स अलग अलग उसमें पेशेंट से मिलते हैं, तो ये बहुत डिफिकल्ट हो जाता है इसको डायग्नोज करना. ठीक है. हाउ डज नार्कोलेप्सी अफेक्ट योर बॉडी? टू अंडरस्टैंड नार्कोलेप्सी इट हेल्प्स टू नो मोर अबाउट द ह्यूमन स्लीप साइकिल. आपका मैंने ह्यूमन स्लीप साइकिल आपको पढ़ा रखा है. स्टेज 1 में आपका लाइट स्लीप होता है, स्टेज 2 में डीपर स्लीप, स्टेज 3 में स्लो वेव स्लीप होता है. REM स्लीप स्टैंड्स फॉर rapid eye movement. The stage is when a person is in REM sleep, you can see their eyes move beneath there. ओके. व्हाट कॉजेज नार्कोलेप्सी? नार्कोलेप्सी में टाइप 1 नार्कोलेप्सी में क्या होता है कि आपका जो हाइपोथैलेमस होता है ब्रेन के अंदर, उसमें एक प्रॉपर न्यूरॉन्स होते हैं दैट हेल्प्स यू वर्क फॉर स्लीप वेक साइकिल बिकॉज दे प्रोड्यूस orexin, and that is also orexin A and orexin B. That is also called hypocretin 1 and hypocretin 2 is a molecule produced by neuron that is usually detectable in cerebrospinal fluid, that is CSF, a thin layer of fluid surrounding cushioning your brain and spinal cord. However, CSF levels of orexin are very low and undetectable in people with narcolepsy. ये आपका स्लीप वेक साइकिल को इंप्रूव करता है ऑरेक्सिन. और अगर आपको एक्चुअली में इसका काम होता है एक्साइटरी, आपको उठाना और फिर सुलाना. दैट में और जब नार्कोलेप्सी जब होता है तो उनमें ये कम होता है. That means the cells that make orexin either stop working or sometimes something destroyed them. ठीक है. टाइप 2 नार्कोलेप्सी में क्या होता है? While experts know much of the type 1 narcolepsy, that's not the case with narcolepsy 2. Experts still don't fully understand what type of narcolepsy 2 happens. क्यों होता है अभी तक इनके बारे में कोई, और कुछ लोग तो कहते हैं सिमिलर रीजंस की वजह से होता है नार्कोलेप्सी टाइप 2. सेकेंडरी नार्कोलेप्सी में क्या होता है कि ब्रेन इंजरीज हो जाती हैं, आपका ब्रेन ट्यूमर्स की वजह से हो सकता है और अदर कंडीशंस की वजह से हो सकता है. नार्कोलेप्सी कैन आल्सो हैपन एज अ फीचर ऑफ अनरिलेटेड कंडीशन दैट यू कैन inherit. Examples of this kind is autosomal dominant cerebral ataxia और narcolepsy and deafness में भी हो सकता है. Autosomal dominant narcolepsy, type 2 diabetes and obesity में भी हो सकता है. What test will be done to diagnose narcolepsy? वही sleep disorders वाले test है. Sleep study, polysomnogram. Some possible tests for diagnosing narcolepsy include multiple sleep latency test हो सकता है, maintenance and wakefulness test, नंबर पंक्चर में करके भी टेस्ट कर सकते हैं, हाइपोक्रेटिन चेक करके कि हाइपोक्रेटिन और ऑरेक्सिन का लेवल कैसा है. ठीक है. अब मैनेजमेंट एंड ट्रीटमेंट्स में क्या दे सकते हैं? पेशेंट को एम्फेटामीन और एम्फेटामीन लाइक स्टिमुलेंट दे सकते हैं. ड्रग्स लाइक मिथाइलफेनेडेट, below better known under several trade names like Ritalin, Concert or Cleveland combination that can help you एज अ सेडेटिव. और एंटीडिप्रेसेंट दे सकते हैं, SSRI और सेरोटोनिन नॉरएपिनेफ्रिन रेपिटेक इनहिबिटर्स भी दे सकते हैं सच एज वेनिफिलिन, एंड सेलेक्टिव सेरोटोनिन रेपिटेक इनहिबिटर्स भी दे सकते हैं. ये सब ड्रग्स दे सकते हैं विच कैन हेल्प यू। अगर डिप्रेशन की वजह से भी नार्कोलेप्सी हो रहा है तो दैट कैन हेल्प यू इन डिप्रेशन, और आप बीच बीच में उठ रहे हो उस वजह से सोडियम ऑक्सीबेट दे सकते हैं। दिस ड्रग कैन हेल्प यू स्लीप एंड ऑल्सो रिड्यूस ऑफन हाउ ऑफन कैटाप्लेक्सी हैपेंस। कैटाप्लेक्सिन को रिमूव कर इंप्रूव करता है और जिससे कैटाप्लेक्सी होता नहीं है। हिस्टामीन अफेक्टिंग ड्रग्स, एन एग्जांपल ऑफ दिस ड्रग इज पिटोजिलिन and histamine receptor antagonists are drugs that block specific chemicals in your body from attaching the cell, that slows down or prevent the cells from doing certain things. तो ये आपका हेल्प कर सकता है नार्कोलेप्सी में। These are the thing। नार्कोलेप्सी के साथ आपका स्किज़ोफ्रेनिया डिसऑर्डर्स भी आ सकते हैं, ठीक है, क्योंकि हेलुसिनेशन और साइकोसिस इसमें भी है और उसमें से भी। सो कुछ स्किज़ोफ्रेनिया वाले लोगों को नार्कोलेप्सी वाले सिम्टम्स भी आ सकते हैं, या फिर नार्कोलेप्सी वाले सिम्टम्स को स्किज़ोफ्रेनिया भी कोमॉर्बिडिटी में आ सकता है। So that is all about narcolepsy. In my next video, I will talk about sleep apnea. Thank you.